The neon duct tape Victoriano Diaz lays on the ground is not an arbitrary decision.
Regular tape is going to get dirty. You're not going to be able to see it on this pavement once people start standing on it. So fluorescent tape seems to work well for us.
It's a tip picked up after nearly a year of ushering socially distanced crowds through COVID-19 testing sites operated by Family Health Centers of San Diego. The nonprofit is the largest network of community clinics serving San Diegans.
Where we'll have a patient wait in line.
The carefully spaced spots will safely direct up to 750 daily visitors to a COVID-19 vaccination. But Diaz and his team must first draw out and plan out every detail before the first dose.
There's all kinds of small little idiosyncrasies that people aren't aware of that we need to plan for. So simple things like your vaccination card. Like where is this vaccination card going to be given to the person and who's going to write it?
This meticulous planning of a site is critical to reaching San Diego County's vaccination goal. Officials say every shot counts to vaccinate 1.8 million San Diegans by July. And community clinics are key to reaching underserved communities most affected by COVID-19.
So this is an aerial shot of our Logan Heights Family Health Centers, which is our largest site that we're going to be providing vaccinations.
Half of the rectangle lot already holds a testing site. The team must plot out how to weave vaccine recipients through 4 zones designed to control bottlenecks.
So we want the patient to still have a good experience. We want them to just be standing here waiting. So we want them to have a seating area that they're going to wait if we do have to take a little bit more time with the patient when giving that vaccine.
But Diaz is already planning for long lines stretching along the sidewalk, like they saw for testing.
We would have 50 to 60 people that were here at 5 o'clock in the morning.
The clinic zip code has one of the highest rates of COVID-19 infections in the county, but the site, with a clear view of the Coronado Bay Bridge, is also in an area that has the lowest vaccinations.
So we're looking at maybe having a couple of different points of where people are going to be standing. So maybe this side of the fence might be patients that are going to be scheduled for that first hour, and then maybe on that side of the fence there'll be another line for the patients to be scheduled for that next hour.
They also need to recruit and train the volunteers that will pre-screen, register, and guide patients through the orchestrated maze. And they'll have to develop a system to track the 15-minute observation period for dozens of patients with various vaccination times.
Who's going to be clocking the 15 minutes when people are sitting down, and how do we know that person's 15 minutes just started?
And they have to find secure storage for supplies when not in use.
You know, there is talk about maybe putting a storage shed on site also to store non-medical supplies, because that's another consideration, is how much equipment that we need to have there.
Each day they'll reflect on the lessons learned, because they have to make sure every single daily patient returns in a few weeks for their second dose.
We're going to come up to the chair and we're going to introduce ourselves, thank them for taking the time and the courage to get their vaccine today.
The extra focus on patient experience is what Diaz hopes will bring them back for round 2. The site was set to launch early next week, but they received word on Thursday that the incoming vaccine supply wouldn't be enough. Family Health Centers hopes shipments from the Biden administration's new program will reach them the week after next. Tarryn, Mento, KPBS News.